psychiatrist, I think the COVID and the pandemic and lockdown has had a huge impact on the amount of clients that we're seeing with ADHD, either previously diagnosed ADHD, or I'm seeing a huge number of clients with previously undiagnosed ADHD. And most clients who come to see me don't actually come with ADHD. That's not they're presenting a complaint, but they come with comorbidity associated with ADHD. So if you think of any mental health disorder or presentation as being like layers of an onion, people come to me with sort of depression, anxiety, that sort of thing. But if you peel underneath the layers of the onion, you get to the core condition. So lots of clients I'm seeing are presenting with ADHD-related comorbidities such as atypical depression, anxiety disorders, self-harm, problems with their temper, irritability, substance misuse issues. But if you actually get to if you do a proper assessment, then you actually realise they've got ADHD. And I think if you realise that the ADHD brain needs stimulation, and that's from a very crude point of view, that the pandemic has been constricting for all our lives in terms of not being able to socialise with people, not being able to work. And lots of people with ADHD have struggled. Lots of people with ADHD, previously undiagnosed ADHD, rely on physical exercise. We all need physical exercise, but people with ADHD really rely on it. So just because of the complexities of COVID and people's lives have gone from here to here, people with ADHD whose traits have never been recognised before, the traits of what I call reverberated, they've got more and more significant. Most people have come to see me not with specifically ADHD, they've come to see me with atypical depressive disorders, anxiety, substance misuse, problems regulating their temper with their family, feeling really bored and frustrated. Some people have self-harmed. I've seen large numbers of people coming forward with ADHD. But it's always quite a shock because obviously they don't expect that sort of diagnosis. But lots of people go through a bit of a bereavement phase when they know they have ADHD and they wish it was discovered earlier in life, and perhaps their life could have taken a different trajectory. But most people move past that grieving phase and they see the diagnosis as extremely positive, whether they take medication or not, but just knowing about ADHD, and it suddenly makes sense of all their complex difficulties, whether they're relationship issues. So lots of people with ADHD have what we call rejection sensitivity dysphoria, where they struggle in interpersonal relationships, they're very sensitive to criticism. So the diagnosis actually provides a huge amount of relief for the vast majority of people. ADHD is a complex disorder, but there's a huge amount of positive attributes to having ADHD. So most people with ADHD are very likeable, they're very engaging, they can be life and soul of the party, people gravitate towards them. The ADHD brain is a risk-taking brain, but used positively, that could be really helpful. So ADHD is related to entrepreneurialism. So Richard Branson has ADHD. So lots of very successful entrepreneurs actually have ADHD traits, and ADHD is a spectrum. ADHD is related to creativity, so they actually do very well from a creative point of view. And actually medication doesn't dampen down that creativity, it just helps with the focus, so they actually do much better in their working lives. So ADHD has a lot of positive attributes to it.